Getting in and out of the vehicle. With your back to the seat, place your left hand on the dashboard and your right hand on the back of the seat. Gently lower yourself into the seat. Your caregiver will then take your walker and give you your leg lifter device. You can then gently ease your left leg into the vehicle and using your leg lifter device, assist in getting your right leg into the vehicle. Ease into the back of the seat. To exit the vehicle, using your leg lifter device, ease your right leg out, followed by your left leg. Your caregiver will then take your leg lifter device and give you your walker. Place your left hand on the dashboard and your right hand on the back of the seat. Gently lift yourself up, take your walker, and you may go.
We're going to teach you how to go up a curb step because we know you have one at home. So we want you to walk right up to that curb with your walker and then bring your feet about 1 inch away from the curb step. Now put your walker up on the step. The thing to remember is the sequence. When you're going up a step, we want you to always go up with your strong leg first. So go up with the good leg first, and then bring your sore leg up. Perfect. I want to teach you how to go down the stairs. When you go down the stairs, you're going to bring your walker to the edge of the step, and bring your feet to the edge of the step. Bring your walker down the curb step, and now I want you to remember to step down with your sore leg first, and then bring your good leg down. Your feet are about 1 inch away from the curb. Perfect. Then you're going to bring your walker up onto the curb step, and this is the sequence that I want you to remember. You're going to go up the curb step with your good leg first. So you're going to bring your right leg up, and then step up with your sore leg, your left leg. Excellent. Now, you're going to bring your walker down to the ground, and the sequence that I want you to remember for going down is to always go down with your sore leg first. So you're going to go down with your left operative side first, and then your right leg. Perfect. The physical therapist will help teach exercises that help promote circulation, promote flexibility in the new joint, and also help to strengthen the new joint so that it's easier to walk and also so that you have less pain. Ankle pumps is an excellent exercise for promoting circulation and preventing blood clots. With this exercise, you're going to flex your ankles, bringing your toes all the way up towards your nose, stretching your calf muscle, and then pointing your toes down towards the floor. Pull up all the way towards your nose, and then point your toes away, almost like you're stepping on a gas pedal. That helps to tighten your calf muscles and helps to promote circulation, preventing blood clots. The next exercise helps to strengthen the quadricep muscle around your knee. With this exercise, the goal is to try to straighten the knee all the way out by flattening the back of the knee to the bed. You're going to try to tighten the muscle on your thigh and then relax. One of the things that helps with this exercise is as you're tightening your thigh muscle, pull your toes towards your nose and hold for 5 seconds and then relax. So tighten the thigh muscle, pull the toes towards your nose, press the back of the knee down to the bed, and relax. The third exercise that helps prevent blood clots by promoting circulation and helps to strengthen the muscles is to tighten the buttocks muscles by squeezing the buttocks muscles tight, almost lifting the hips a little bit from the bed, hold for 5 seconds, and then relax. tighten the muscles of the buttocks, lift your bottom a little bit, hold for 5 seconds, and relax. The next exercise helps to promote flexibility of your knee. With this exercise, you're going to try to drag your heel towards your bottom, slowly, bending your new knee joint. When you start to feel a little tightness and discomfort, pause, and then see if you can bend it a little bit further. Hold for 5 seconds, and then straighten the leg out all the way. This exercise helps to promote flexibility of your new knee joint. The next exercise helps to strengthen the thigh muscles, which are the main walking muscles. This is called a straight leg raise. We want to make sure that this exercise is done correctly so that your back doesn't become sore. So we'd like you to bend your unaffected leg up and put your foot on the bed. In that position, you're going to curl the toes of your operated leg towards your nose, tighten that thigh muscle, and lift the leg 4 to 6 inches up off of the bed. Pause, and then slowly lower it back down to the bed. If that exercise is difficult to do, push the knee down into the bed first, then lift the leg 4 to 6 inches. Hold for about a second, and then slowly lower down. In order to strengthen the leg, we also teach exercises in sitting. This is a great position to strengthen the upper leg muscles as well as the lower leg muscles, which help give stability to the new joint and help you walk. The first exercise that we're going to do is hip flexor strengthening or marching. With this exercise, it's best to scoot forward so you're sitting on the edge of the chair. And then we want you to try to keep your foot back directly under the knee. That might be a little bit uncomfortable, but that's the best position to do the exercise. With this exercise, you're trying to tighten your upper thigh muscle as you lift your leg up about 4 to 6 inches and bring it down. You don't have to hold this exercise, just try to go smoothly up and down, keeping the foot directly underneath the knee. Very good. The next exercise works on strengthening the lower portion of the quad muscle or the thigh muscle. With this exercise, you want to have your thigh fully supported, so you want to scoot back in your chair. We like to use a chair with arms because that's the safest for getting in and out of. With this exercise, you're trying to tighten the muscle right here, tightening your kneecap as you pull your toes back towards your nose and straighten the leg all the way out. It's important to hold for 5 seconds and then slowly lower the foot down so it comes to rest directly underneath the knee. The next 2 exercises help to promote flexibility. With the first exercise, we're going to have you sitting in the chair, scooted about halfway forward in the chair. The goal here is to try to bend the knee as much as possible. The first part of the exercise has you tighten your hamstring muscle on the back of the thigh and try to draw the foot back. Now, you might feel like it's tight and hard to move further, so then we're going to have you put your unoperated leg crossed over your operated leg and use your unoperated leg to push back a little bit more. The third part of the exercise has you uncross your legs, but keep your operated foot where it is on the ground, and now you're very gently going to use your hands on the armrest of the chair to scoot forward, gently trying to stretch the knee a little bit further. Now this is an intense stretch, so go slowly. Don't feel like you have to stretch beyond your abilities. Very good. Straightening the knee out all the way is just as important as bending it all the way. Sometimes it's very difficult to get the last few degrees of extension, and this exercise will help you gain that ability to straighten your leg out all the way. Sitting in the chair, you're going to put your operated leg up on a footstool. You could also put it up on another chair. A coffee table would work too. With this exercise, you want to pull your toes and curl them towards your nose. You want to tighten your thigh muscle and push the back of your knee down towards the ground. And you can take your hand and put it above your incision. We don't want you to put it on your incision because that might hurt. But you can put your hand on your upper thigh muscle and push straight down towards the floor. And that helps you straighten the leg out all the way. Good job. When you go up your stairs at home, we want to teach you the safest way to do that. If you have 2 rails at home on your stairs, that's the safest way. If you don't, we'll also show you how to do it with 1 rail and a cane, or 1 rail and a crutch. Let's start with the 2 rails. When you go up the stairs, you're going to go up with your good leg first, your unoperated leg, and then you're going to draw your sore leg up, taking the steps 1 at a time. Good job. Up with the good, bring the sore leg up. Step up with the good, bring the sore leg up, and step up with the good leg, and bring the sore leg up. When you come down the stairs, you're going to hold on to your railings, and the sequence coming down is that you bring your sore leg down first, and then bring your strong leg down. Bring your sore leg down, and then your strong leg. Whoops, 1 step at a time. Sore leg, good leg, bring your sore leg, and your good leg. I'm going to teach you how to go up your stairs because you only have 1 railing at home. We want you to have support in both of your hands when you're going up the stairs. So I'm going to teach you how to go up the stairs with a railing on your left hand and your cane in your right hand. Were they coming through?
Hey, and they start picking up their sound.
No. I'm going to teach you how to go up your stairs because you only have 1 railing at home. And we want to teach you to have something in both hands for safety as you go up and down your stairs. So we have your cane in your right hand, and your railing is on the left as you're going up your stairs at home. So I'm going to ask you to step up about 1 inch away from the steps. And the proper way to go up the steps is to go up with your good leg first, and then bring the cane and your sore leg up the steps. And bring the good leg up, and bring the cane and the sore leg up. Bring the good leg up, bring the cane and the sore leg up. Bring the good leg up, and bring the cane and the sore leg up. Perfect. Now, let's teach you how to go down the stairs. Your railing is still going to be on the same side, so now it'll be in your right hand. The cane will go in your left hand. You're going to step with both feet to the edge of the steps. Now, this is very important. The cane always goes first to receive the sore leg. So the cane's going to go down first, then your sore leg, and then your good leg. Then the cane, the sore leg, and the good leg, the cane, the sore leg, good leg, and the cane, and then the sore leg, and the good leg. Perfect. I'm going to teach you how to go up the stairs with a railing and a crutch because you only have 1 railing at home. And the crutch will give you more safety because we want you to have support for both of your hands going up and down the steps. The correct sequence going up the steps is to always go up with the good leg first. Your crutch is going to stay with your sore leg, so it's either going to come up at the same time as the sore leg, or it's going to come up after you bring your sore leg up. We'll go ahead and try it. Let's have you step up with your good leg and bring your sore leg and the crutch up. Perfect. Up with the good, sore leg and crutch. Up with your good leg, bring your sore leg and the crutch up, and step up with your good leg and the sore leg and your crutch. Perfect. Now let's show you how to come down the steps. Your railing is still going to be on the same side, so now you're going to hold on to it with your right hand. Your crutch is going to be under your left arm. This is very important. First of all, you're going to line yourself up so your feet are at the edge of the steps. Now your crutch is always going to come down first to receive the sore leg. So you bring your crutch down, step down with your sore leg, and then your good leg. Bring your crutch down, step down with your sore leg, and your good leg. Bring your crutch down, sore leg, good leg, and bring your crutch down, and your sore leg, and your good leg. I'd like to show you how to walk with your walker. When you're walking with a walker, we want you to stand up tall. We have your hands on your walker so you're getting support through it. And we want you to stay within the walker when you're walking. We don't want the walker to be too far in front, and we don't want to have it too close to you. When you're walking with the walker, you're going to lead off with your sore leg first. So you're going to push the walker forward, step with your right foot, and then step to it with your left foot. You're going to push the walker forward, bring your right foot, and then your left foot. When your leg is sore and you feel a little bit weak, this is the safest way to walk. So walker, right foot, left foot, and we'll take one more step. When your leg feels stronger, you can start to put one foot in front of the other. This will help you feel like you're walking more naturally. It'll also help you feel like you're going a little bit faster. So as the leg feels stronger, you're going to move the walker forward, leading off with your right foot, and just putting one foot in front of the other, staying right within your walker. Perfect. Now that you've gained strength in your leg, I'm going to show you how to walk with the cane. When you're using the cane, you're going to bring it forward about 4 to 6 inches in front and to the side. You're going to lead off with the sore right leg again and just step to the cane, and then step beyond it with your left foot. Would you like to try that as you walk?
Using your walker, walk to the commode and turn yourself around. Back up until you can feel the commode behind your legs. Stick your surgery leg out in front. Reach your hands back for the handles on the commode and slowly lower down. So come back up to standing. Push from the arms up into standing, and then grab your walker. Back up to the tub bench using your walker. Surgery leg sticks out in front. Reach back for the chair and slowly lower down to sitting. Push your walker just a little bit out of your way. Grab your leg lifter. Spin your bottom. Leg lifter on your surgical leg. Lift it up and over the edge of the tub. Scoot your bottom in towards the tub. Non-surgical leg comes up and in. And then scoot one more time. To come out, scoot towards the edge of the tub. Non-surgical leg comes up and over. Scoot one more time. Surgical leg using the leg lifter comes up and over. And then pivot on your bottom. Leg lifter can come off of your foot. Bring your walker closer to you. Push up from the chair to stand. Using the long-handled reacher, hook it into the elastic band on your sock. Push it down over the heel of your foot. And then all the way off your toes. And then the right leg, same thing. Hook it into the elastic band on the sock. Push down over your heel and off over your toes. To put your pants on, you'll use the long-handled reacher. You start with your surgical leg and you bunch the pant leg up from the waistband all the way down to the toes, creating a nice hole. Thread the reacher through the hole. Bring it down to your surgical leg, foot, thread it over your toes. Once you get it over your toes, move the reacher to the waistband of the pants and pull. Once the pants reach your knees, you may use your hands. To get your unaffected leg into your pants, use the reacher, put it on the waistband of the pants, bring it down, and step the unaffected leg up and in to your pant leg. Once the pants reach your knees, you may use your hands. To take them back off, you'll take it off of your non-affected leg first. So use the reacher, push it down over your non-affected leg, and that leg can step up and out of the pant leg. And then you'll remove the pants from your surgical leg by pushing over your heel. Using the sock aid, we'll put your socks back on. Take your socks and stretch it over the sock aid so that the elastic band of your sock gets down to the knots. Do not go over the knots. Bunch any remaining fabric down so that the toes are tight on the end. Using the long string, you'll dangle it down in front of your foot. Wiggle your foot in, straighten your knee, point your toes, and pull. If you need to adjust the sock at any point, you can use the reacher once you have it on your foot. And then using the sock aid, we'll do the other foot as well.